As Niger State joined worldwide celebration of 2026 World Health Day, Nigerians have been advised to prioritize their health status by engaging on frequent medical checkup. The State Commissioner of Health, Dr. Murtala Mohammed Bagana, gave the advice while briefing pressmen to mark this year's World Health Day held at the Ministry of Health Conference Hall. Mina, the reports.
This year, 2026 World Health Day, with a theme Together for Health, stand with science, a day set aside not only to celebrate progress in health, but also to confront our reality, renew our commitment, and define the future of healthcare for people. While addressing the press to mark the World Health Day, the Niger State Commissioner of Health, Dr. Murtala Mohammed Bagana, said this year's commemorations come at a critical time as the global health landscape is rapidly evolving, marked by emerging diseases, rising healthcare costs, workforce pressure, and increasing public expectations of government-led health system. Dr. Murtala Bagana said, through the new Niger Health Agenda, they are deliberately and systematically laying the foundation for a health system that will work not just in theory but in practice. He maintained that the ministry is currently finalizing a comprehensive framework for the reactivation and institutionalization of the Patient Information and Complaint Office (PICO) across public health facilities in Niger State.
Care services in Niger State, we are doing a lot around science, and I've just enumerated some of them. One is even in our healthcare service delivery, we are using science to map out how many children can we possibly vaccinate, for example. And we did that with what we call micro-planning. In the micro-planning, we go to every settlement and we estimate every household how many children can a typical family have. Of course, we know most of our families are polygamous. We were able to put that, and with a modeling, we were able to estimate that there are 2.5 million under 5 children in Niger State. This is quite different from 1.6 and 1.7 million under 5 we have been using to plan our activities. Little wonder we are having outbreak. What it means is with science, we can predict with some certainty that we are actually not covering the number of children we are supposed to. But we have been able to do that with science. That is one. Secondly, even the facilities where these services will be provided, we are using science to geolocate all the healthcare facilities. There are over 1,900 primary healthcare facilities in Niger State.
Also speaking, the Permanent Secretary of the Ministry, Dr. Abdullahi Usman Imam, described the event as marvelous in the history of the Ministry of Health in Niger State.
And hopefully we have enough time to be able to do it. And hopefully again, I'm going to pray that we continue to have this amazing team to continue to drive what we're doing. So I want to thank everyone that has played a part in all that we're doing, not just for this World Health Day, but for all that is happening. We have a very, strengthened and elaborate partnership now with the media, and so everything we're doing is out there, and it's only good for us too that it's happening at a time when technology is also everything. You can see how we're having practically a live commentary of all that has happened from 7 a.m. this morning until now. So we can't have enough of this, Honorable Commissioner, and we want to thank you. We want to thank everyone. We want to thank everybody, all the health workers. We want to thank you for the cooperation that you have extended to us all.
During the press briefing, which attracted supporting partners, media, and key staff of the ministry, highlighted a key issue in health sector.
I am glad to inform you that we are actually very delighted to partner with the Niger State government in terms of health. Today that we are commemorating the World Health Day happens to coincide with I call it birthday of WHO. And as you know, WHO, the lead in terms of United Nations arm of health organizations, is always available here to ensure that all the good things that the government of Niger have in place, we are providing guidance. We are ensuring that we provide both catalytic support in terms of funding, and we are providing them the direction in which science have proven to be right. Just like the theme of this World Health Day 2026, that is talking about stand together with health, stand for science.
Specifically, research and innovation as foundation for health, security, and sustainable development. We also call on the international partners, of course including WHO, to strengthen support for African-led science, foster equitable partnership, and expand access to technology and knowledge. Science should be as unrestricted as the health threats we face. A breakthrough that is not accessible to those who need it most remains an unfinished work. When African innovation is fully supported and connected to global efforts, all humanity benefits. Through science and solidarity, we can build a healthier and safer future for all. Thank you.
As part of activities to commemorate the day, World Health Day work was staged from primary healthcare Old Airport Road, route to Government House, and terminated at Old Secretariat. It also featured free medical outreach to Niger Light. Ahmad Yusuf reporting for NSTV News.